Hi students, today I am going to discuss about heavy metal poisoning. Before this we will see what is mean by heavy metals. Heavy metals are metallic chemical elements and having high density. Here density means they have these metals having high value, and these heavy metals are all toxic or poisonous in even at low concentrations. These are all high density heavy metals and also having toxic or poisonous even at low concentration. These are some of the examples of heavy metals are mercury, arsenic, lead, aluminium, cadmium, copper and iron. These are some of the examples of heavy metals. Next we will see the toxicity of heavy metals depends upon the number of factors. The toxicity or poison of the heavy metals will depend upon the following factors. First one is the total dose absorbed. Here that means how much dose or quantity of particular heavy metals are absorbed by the patient. It is depending upon the dose of the heavy metals. Next, acute or chronic exposure. That means here length of the exposure or the length of the time of exposure is main factor depending upon the poison of the heavy metals. Here acute means the toxicity will occur suddenly. Here chronic means the toxicity will occur slowly developed. This toxicity will develop very slowly. Acute means the toxicity occurs very suddenly. Next, here also we will see this heavy metal poisoning or toxicity depends upon the age of the person. It may mainly the heavy metal poisons are mainly attacked to children or geriatrics, that means old patients, because their immunity power will be less, their immune response will be low. That's why it will mainly occur to the children and old age people. Next, the route of exposure. This toxicity also depending upon the route of exposure. These are some of the factors depending upon the heavy metal toxicity. Next, we will see the common treatment for this all heavy metal poisoning. There will be some common treatment for this heavy metal poisonings. Okay. The first treatment is removal of the patient from the source of exposure. Removal of the patient from the source of exposure. That means, for example, if the person or the patient is working in an aluminium factory and he attacked with the aluminium toxicity or poisoning. In this case, first we want to make the patient to not go to the company. Why? Because his source of aluminium toxicity is the company. From company only he is getting that aluminium exposure. Like that, in every poisoning we want to remove the patient first from the source of exposure. Next one is resuscitation. Resuscitation means it is normally stabilization and evaluation, what we discussed in the previous videos. The stabilization and evaluation. First we want to check the stabilization and we want to evaluate the patient. In that mainly we want to go for ABC. That means we want to check airway, breathing and circulation of the patient. Then only we will go for if the patient need any electrolytes. If patient have any electrolyte disturbances, then we want to replace the fluid and electrolytes to the patients. Then after this only we will go for the decontamination. Decontamination means already you know this is we are removing the poisoning from the stomach. Mainly for this heavy metal poisonings we are doing the technique whole bowl irrigation. We are doing the technique whole bowl irrigation. That means we are cleaning the complete stomach with PEG, polyethylene glycol electrolyte solution. First we want to remove the patient from the exposure. Next we want to stabilize and evaluate the patient. Next only we want to go for decontamination. After this, the main treatment we used in heavy metal poisoning is chillation. Okay, the chillation is a very important treatment in heavy metal poisoning. We will use this chillation therapy only in this heavy metal toxicity. Okay, this chillation can done by the chillating agents. This chillation is can done by the chillating agents. Chillating agents are nothing but these are the chemical compounds that react with the metal ions, that means heavy metals, and forms a stable water soluble complex. It forms a stable water soluble complex. This chelating agents also called as chillants, chillator, sequestering agents. Chillants, chillators or sequestering agents. These are all we are using in the treatment of the heavy metal poisoning. Next we will see the mechanism action of this chillating agents. Normally these heavy metals are not soluble in the water and this won't eliminate fastly from the body. In this case we are using the treatment of chillating agent. The chillators will increase the elimination of the heavy metals from the body. Why we are using chillators? To increase the heavy metals to increase the heavy metal excretion from the body. Normally the chillators will excrete this heavy metal from the urine. Okay, this is about the mechanism of the chillating agent. Next we will see the ideal properties of this chillating agents, otherwise chillators. These chillators are low order of toxicity. These chillating agents does not have any toxicity. If toxicity is there, that is also very low toxicity. Next, these chillating agents do not redistribute to the other organs. Only this will act on the heavy metals and it eliminates the heavy metals from the body. That much only. This chillators does not distribute the other parts of the body. Next, this chillating agent eliminates quickly without breakdown. Normally, these chillators also chemical substance, but this won't break down in the body and it eliminates fastly through the urine. Next, the contraindications of chillating agents are, in these conditions we should not use this chillation therapy. In case of liver failure, during iron supplementation, if the patient is taking any iron supplementation, in that condition we should not use these chillating agents. Next, peanut allergy, if the patient have peanut allergy, if the patient have glucose 6-phosphate dehydrogenase deficiency, in these 4 conditions we should not use this chillation therapy. Okay, next we have some of the examples of chillating agents here. Here the agents are dimercaprol, also we will call BAL, also we also call British Antilevysite. Dimercaprol or British Antilevysite. This antidote or chillating agents will used in arsenic, mercury and lead poisoning. Next we have next chillating agent dimercaptosuccinic acid. Dimercaptosuccinic acid we also call as succimer. This will be used in lead poisoning. Next we will have calcium disodium editate, EDTA, calcium disodium editate. This will be used in lead poisoning. Next, penicillamine will be used in lead, mercury and copper poisonings, and also we'll have deferoxamine we can use in iron poisoning, and also we'll have deferiprone we can use it in a iron poisoning. These are some of the examples of chillating agent. Different chillating agents we are going to use in different type of poisonings. Okay, next we will see the detailed information about some of the important chillating agents like dimercaprol, EDTA and penicillamine. We will see first one, dimercaprol. Dimercaprol also called as British Antilevysite. This is the medication normally used to treat arsenic, mercury and lead poisonings. Why we are calling dimercaprol as British Antilevysite means, first we will see British. Here this medication is developed by the British biochemists at Oxford University during World War II. That's why we are calling it as a British. Why we are calling Antilevysite means, this medication will be used as a antidote for Levysite. That's why Antilevysite. What is mean by this Levysite? Levysite is a organo-arsenic compound. Before the World War I, this Levysite is manufactured in the US, Japan and Germany, and it is used as a chemical weapon at the time of World War I. It used as a chemical weapon at World War I. These chemical weapons are act as a vesicants and lung irritant. This chemical weapon is act as a vesicant and lung irritant. That means it causes severe skin, eye and mucosal pain and irritation, and makes the person more ill, and it also causes painful water blisters on the skin. For this Levisite, for acting against the Levisite only, they prepared this dimercaprol. Who prepared this dimercaprol? British biochemist. That's why he is calling as a British Antilevysite. Okay, next we will see some of the adverse effects of this dimercaprol are high blood pressure, pain at injection site, vomiting, fever. And this dimercaprol is contraindicated in peanut allergic persons or peanut allergic patients. The route of administration of this dimercaprol is intramuscular route. Next, the uses of this dimercaprol are lead and arsenic poisoning. It is also used as antidote to the chemical weapon Levisite, and also we can use it as a Wilson's disease. Wilson's disease means it is a genetic disorder. That means when there is a copper is built inside the liver and other tissues, when the copper is accumulated in the liver, that condition is called Wilson disease. In these three conditions we are using this dimercaprol. Next one is penicillamine. This penicillamine is discovered by the John Walsh. John Walsh is the first described the use of penicillamine in Wilson's disease in 1956. He was the first described the use of penicillamine in Wilson's disease in 1956. He had discovered that this compound is presented in the urine of the patient who is taking penicillin. Penicillin is the one of the antibiotic. The patients who is taking the penicillin, this John Walsh found that this penicillamine in their urine. This experimentally confirmed that it is increased urine copper excretion by chelation. Okay, what he found in the urine of the patients who is taking penicillin, he founded this penicillamine. In that urine only he founded this penicillin. This penicillamine is increasing the copper excretion through the urine by the process of chelation. He founded this, including himself. He also taken penicillin at that time. He also found the same thing in his urine sample also. Okay, that's why we confirm this penicillin is mainly used in the copper poisoning. The adverse effect of this penicillamine is rash, loss of appetite, nausea, diarrhea, low WBC levels, white blood cells levels, and also we can use this penicillamine through oral route. The uses of this penicillamine is rheumatoid arthritis, Wilson's disease, scleroderma, kidney stones, and also will used in heavy metal poisonings. Here scleroderma means it is the hardening and tightening of the skin and connective tissue, hardening of the skin. This mostly affects to the women. The scleroderma mostly affect to the women. In these conditions we are going to use this penicillamine chelating agent. Okay, the next one is EDTA, calcium disodium editate. This EDTA came into the medical use in 1953. Normally first this EDTA used in the lead poisoning along with the dimercaprol. We won't use this EDTA as a single chelating agent. We will combine with the dimercaprol and we will use it in the lead poisoning. Normally this EDTA is a salt of editate with 2 sodium and 1 calcium atom. That's why calcium disodium. 2 sodium and 1 calcium atom is containing in this EDTA. That's why we are calling calcium disodium. Okay, it works by binding to the heavy metals which allows them to leave from the urine, same like the chelating agents mechanism. Okay, the side effects or adverse effect of this EDTA are pain at injection site, kidney problems, diarrhea, fever, muscle pains, low blood pressure. These are some of the adverse effects of this EDTA. Okay, this is all about the heavy metal poisonings in their general or common treatment of heavy metal poisonings. The common treatment we'll use in heavy metal poisons are chellation therapy. This chelating agents also called as a heavy metal antagonists. Okay, all of you understood? Thank you.